Inland Valley Medical Center presents the Total Joint Replacement Shoulder Program, a preoperative education program. In 2018, Inland Valley Medical Center was awarded the Center of Distinction from the Joint Commission for its total joint programs. The role of the program coordinator is to coordinate preoperative education for patients, to work with the medical team on interdisciplinary rounding, to follow up on any patient concerns, and to follow up with postoperative phone calls to make sure success continues outside of the program. Shanine Netter is our orthopedic program manager. Today's objectives are to discuss pain management, how to care for yourself at home, and discharge planning, which begins preoperatively. We would like for you to understand the procedure itself, the role of a caregiver or team member, what to expect during your hospital stay, and the role of physical and occupational therapy in assisting you in your rehabilitative process. There are a few different procedures when you hear the term total shoulder program. A total shoulder replacement typically involves removal of the damaged bone and cartilage from your shoulder and replaced with an artificial joint called a prosthesis. A different type of procedure is called the total reverse shoulder replacement, and once again, removal of damaged bone and cartilage from the shoulder, in which the artificial joint, which is called a prosthesis, is reversed, thus the name reverse total shoulder. The ball and socket are now switched. Preparing for home, making the home a safe environment for you to return to and recover. Having a chair with solid armrests to allow assisted transfers in and out of a chair. A recliner can be okay. A special bed is not necessary, but making the environment safe is a must. Can you remove throw rugs, power cords, and such? Can you have meals prepared ahead of time, such as a frozen meal? Can that grocery list be filled before surgery? Can any vital items that you might need, such as your medications and clothing, be placed at a level that is safe for you to access? Practicing daily chores with one arm is a must as you replace and repair that shoulder, and arranging for someone to care for such things as pets and other vital chores. The guidebook for preparing for surgery, we're going to cover frequently asked questions, appointment times, pre-op checklists, pre-op exercises, and your typical hospital stay. We are also going to look at caring for yourself at home, the role of the caregiver, discharge instructions, and resuming activities as your doctor guides you. Please bring your guidebook with you to the hospital and all doctor's appointments. Receiving medical clearance comes from your primary doctor. You will have an appointment with your primary care doctor. You will have instructions to stop or change any medications. You will have lab work done. Some of this lab work can also include an electrocardiogram looking at your heart and a chest x-ray looking at your heart and lungs. There might be some additional consultations. Make sure you stop taking medications that may cause bleeding at least 7 to 10 days before surgery. Some medication examples might include aspirin and anti-inflammatories. Please check with your physician regarding medications that may cause bleeding prior to surgery. With pre-admission testings, they're going to check your vital signs such as blood pressure, heart rate, respiratory rate. They're going to look at height and weight. The doctor would review labs, the EKG, and chest x-ray results. A review of your medication list will occur. A copy of your advance directive should be looked at. MRSA screening, and special instructions on showering and bathing the night before surgery and typically the AM before surgery. You will also receive notification of a hospital arrival time. Preoperative nutrition. It's imperative that you drink enough fluids prior to surgery. Adequate protein intake from a well-balanced meal. Increase your fiber intake. If okay with your primary care physician and/or surgeon, take an iron supplement. Adequate calcium along with vitamin D. Decrease alcohol intake prior to surgery. Stop smoking. Smoking delays your healing process. It reduces the size of blood vessels. It increases your blood pressure and heart rate. It increases your chance of having a blood clot. If you need help, please ask our team for resources. Items to bring to the hospital, your guidebook, loose-fitting clothes. Remember, you'll have to put those clothes on after surgery. Are they easy to access, such as a button front shirt? Your doctor will probably provide a sling. You need to bring any shoes or leg orthotics, glasses, hearing aids, and so forth. Breathing machines. Bring your coach. And as always, leave valuables, cash, and medications at home. Who's your coach? Your coach can be any family member or friend. The role of the coach is to provide comfort, motivation, support, and assisting in the therapy sessions. Your job is to gain confidence so you're ready to graduate and discharge home. The day before surgery, nothing to eat or drink after midnight. Shower or bathe with special soap the night before your surgery and the morning of surgery. On the day of surgery, you will report to the emergency room admitting desk at the proper time. Families will be escorted to the pre-op waiting room. The surgeon will speak with the family in the waiting room once surgery is completed. Please note, one designated visitor allowed. Other preparations for pre-op. You will be placed in a hospital gown. They will start an IV. You'll likely be on antibiotics, and the doctor and surgical team will come in and mark the surgical site. You will meet your anesthesiologist and the surgeon. They will review health and medication history and discuss a plan for nausea and pain management. The anesthesiologist will talk about the options that are available to provide success for your surgery. The typical surgery will take about 2 hours. From the surgical room, you will go to the recovery room. There, they will work on stabilizing all of your vital signs, assessing your neurological system and your neuromuscular system. There will be comfort measures provided. The time in the recovery room will vary based on your needs. No visitors are allowed in the recovery room as the medical team is working with you closely. Pain. At Inland Valley Medical Center, we use a visual analog scale, 0 to 10, and a facial grimace scale. Our job is to manage your pain levels. We don't want pain to prevent sleeping, conversation, mobility, or your rehabilitation process. Remember, we can't make pain go away completely. We can manage it with your input. The goal is to manage the discomfort so you can continue to eat, sleep, and mobilize. Postoperative care. Vital signs are measured every 4 hours the first 24 hours and oftentimes even more frequently. Postoperative care. We want to have you up and dressed in the recliner in the morning. We don't want you living in the hospital bed. Hospital beds are for sleeping. An occupational therapist will come in with physician's orders and get you started daily. Physical therapy also will be daily or as needed. Walking. We want you up safely mobilizing with the medical team as much as possible. Therapy services, as stated, they begin the same day, which we call day 0, the day of surgery. The evaluation is often at the bedside. Some of the big picture items, getting in and out of a bed, in and out of a chair, looking at walking quality, distance, device, and safety, mobilizing to and from the restroom, sometimes tackling stairs, and overall transferring from different chairs into even cars. Occupational therapy. Therapists specialize at assisting with activities of daily living. Some of the big picture items include bathing, dressing, hygiene, but can also include eating, grooming, and other skills. Key things to remember following therapy. Safely move. For example, pumping your legs up and down while you're lying down or sitting. Being out of bed on the recliner. Elevating the heels off the bed. With your medical team or a coach when it is safe, walking the hallways. and incentive spirometer. Keep the lungs moving. Shoulder precautions. You and your physician have spent a lot of time and expertise working on getting a new shoulder. You are currently in the maximum protective phase, meaning let's let this shoulder heal. Your surgeon's guidance is the only person that will let you know when you don't have to follow shoulder precautions. Simple shoulder precautions include always be able to visualize your elbow. If you can't see your elbow looking at it, you're probably not in a very safe position. There will be no active range of motion where your muscles are moving the shoulder around. There will be no lifting with the surgical shoulder. Functional activities like tucking in a shirt or reaching behind you to grab maybe a wallet or hygiene. This is extremely dangerous to a new shoulder. This is a no activity. Do not reach behind your backside. Other precautions. Your doctor will have a type of sling or shoulder immobilizer placed on you per your doctor's guidance. Your doctor will also work with therapy and develop a range of motion program where you will carefully move different body parts into different movements as instructed. For example, we'll be looking at your cervical or neck range of motion, your elbow, wrist, and hand range of motion, all right around that new surgical shoulder joint. Preventing post-op complications. Some of those complications that we are working on as a team to prevent include blood clots. Some of the ideas that we have behind the management are leg pumps, early ambulation, and other medical devices to keep circulation moving. To prevent pneumonia and fever, using the incentive spirometer, cough and deep breathing, multiple times an hour, up to at least 10. Preventing complications continued. Infection, frequent vital signs inspection, antibiotics are some of the ways to manage infection. Closely monitoring for nausea or vomiting, including medication management. Constipation, medications, and frequent mobility can assist with managing this problem. Low blood pressure, also known as hypotension, it can be medication-induced. Nurses and doctors will be managing your fluids. Once in a while, a blood transfusion might be considered. Falls. Fall prevention program. We want to ensure your safety at our hospital, and also including going home and being safe. Call or ask for assistance before attempting to mobilize. Simple things such as wearing skid-free socks while walking. Allowing staff to assist you. Let's be careful. Patients might experience discomfort at the incision site, including soreness and pressure. This can be treated from the medical team with pain medications. You might also experience swelling and bruising, as reflected by tightness around the incision. This can be treated with compression and elevation. Other comfort measures. Positional changes frequently. Moving up and down, getting in and out of a chair, walking. Ask the staff if it's okay for your coaches to do some of these positional changes with you. Never refuse to walk, even if you're tired. Your role in managing pain. Intercept the pain. Ask for medication when the pain starts to escalate. Do not get behind. Do not wait. Take your pain medication on a regular basis. Communicate. Tell the nurse if medication is not effective. Ask questions. Be informed. Be sure to understand pain management efforts that are in place and their side effects. The average length of stay for the joint replacement program is 1 to 2 days. It does depend on you. Making a discharge plan, being proactive, having a family and patient, the interview, program coordinator work, the surgeon, therapy team, discharge planning. It's a team process to graduate you in a timely fashion. Discharge planning options. Most folks will return home and start with outpatient therapy services. Some folks return home and therapy services will come to your home called home health PT. Address these transportation arrangements prior to discharge. Be proactive. Discharge medications. Your nurse will review a list of medications as prescribed by the doctor before you discharge. Take pain medication exactly as prescribed. Speak to your surgeon about when to decrease or discontinue pain meds. Take stool softeners. Resume pre-op medications. Blood thinners. Aspirin taken orally and daily. Your surgeon will advise you for how long to take aspirin. Lovenox, a daily injection, no lab tests, taken up to 7 to 10 days. The discharge home. Ride in the front seat. Stop along the way if your ride is more than 2 hours or you become uncomfortable. Take your time and have the therapist instruct you verbally in how to enter and exit a vehicle. Caring for yourself at home. Change positions frequently. Follow your shoulder precautions. Mobilize, walk daily and steadily. Increase your distance. Limit stair use to 2 times a day for the first week at home. Continue with the incentive spirometer. Measure your progress weekly. Do your exercises regularly. Eat healthy, a balanced diet, drink plenty of fluids. Do not smoke. No showering unless otherwise instructed by your surgeon. Follow up with your surgeon in 7 to 10 days or as discussed with your surgeon. We do care. The hospital may call you shortly after your stay with a brief survey. Your feedback is important to us as we develop this Center of Excellence into a higher level. The Orthopedic Program Coordinator will also call you 2 weeks after your stay to monitor your recovery. Our mission: your choice for healthcare, committed to hope, health, and healing. Our vision: building relationships that touch the heart. Our values: integrity, compassion, respect, and courage. Good luck with your surgery. If you have any questions, please feel free to contact Shanine Netter, registered nurse, or your surgeon's office.